Hello everyone, this is Dr. Indhumathi Kuberan, consultant diabetologist from Mumbai. Welcome to Diabetes Eye Openers with Dr. Indhu. I will be sharing clinical pearls from my day-to-day practice, which will be revolving around diabetes, thyroid, and geriatrics. Geriatric age group comprises of individuals above 65 years of age. Our country is witnessing a spurt in the population of geriatric patients, and their needs and treatment are very age specific. Today I will be sharing a case, a very interesting case which I saw when I was quite young. I was just out of college and I was working as a RMO in a small hospital in Roypuram, Chennai, under mentorship of Dr. Harilal. He's my mentor and guru who has taught me all the nuances of clinical medicine. I learned a great deal from him, and one which I learned from him 3 decades back, it was very rare: wait and watch policy. Or, in other words, we can call it masterly inactivity. He never used to be aggressive in his treatment approach when geriatric patients used to get admitted. His approach was very holistic and very patient friendly. I will share with you a small case about a geriatric person who was treated by wait and watch policy. This elderly gentleman, 85-year-old, morbidly obese, around 120 kgs, used to come every 3-4 months for OSA, that is obstructive sleep apnea, or exacerbations of his respiratory problems, or exacerbations of his arthritis. One time he was admitted with problems of abdominal pain, tummy pain. And when Harilal sir examined him, there used to be a grand rounds in the morning from 10 to 11, and I used to accompany him. So when he examined him, he understood that there is some obstruction in the intestines. A surgeon was promptly called. The surgeon said immediately the patient should be taken for surgery. Mind you, the patient is 85 years old, morbidly obese. But Harilal sir understood that he is not a candidate for immediate surgery. So he called the relatives and explained to them about the condition and said that surgery will not be useful for the patient. The relatives agreed readily and opted for a wait and watch policy. So their Riles tube was put into the patient's nose, and just he was on a normal saline drip as just to maintain his hydration. Days passed, the elderly gentleman was not sinking, plus he was not recovering as well. The relatives almost decided that these were the final days of the elderly gentleman. But lo behold, in 1 week, the elderly gentleman started asking for water. And when we examined his abdomen in the grand rounds, sir could hear the intestinal sounds. So the intestinal obstruction, because of the watch and wait policy, had opened up on its own. So this shows that in geriatric patients, always aggressive approach is not needed. An aggressive approach sometimes gives very bad outcomes. Putting them on a ventilator and putting them on a central line and aggressively treating them with plenty of antibiotics and hemodynamic agents will actually do more harm than good. So I learned this great lesson from Harilal sir, that wait and watch policy or masterly inactivity sometimes can save the life of the patient. Thank you.